Hi, I'm Stacy Enders, a policy analyst and workforce shortage co-lead with the Disability Services in the Minnesota Department of Human Services, or DHS.
And I'm Linda Walford, Interagency Coordinator, and the other co-lead on the workforce shortage was Stacy in Disability Services with DHS. In this video, we are going to give you a brief overview of the efforts Minnesotans have taken to address the critical shortage of direct support professionals. At DHS, our mission is to work with many others to help people meet their basic needs so they can live in dignity and achieve their highest potential.
And I'm Oriane Casale, Interim Director of Minnesota's Labor Market Information Office at the Department of Employment and Economic Development. At DEED, our mission is to empower the growth of Minnesota's economy for everyone. In 2017, at the direction of Minnesota's Olmsted Subcabinet, addressing the workforce shortage became part of our Olmsted Plan. Our two agencies were charged with creating a multi-agency stakeholder work group to develop recommendations for expanding, diversifying, and improving Minnesota's direct care and support workforce. Members consist of representatives from DEED, DHS, the Minnesota Department of Health, the Minnesota State Research and Training Center, staff from the Institute on Community Integration, people using services and their families, providers and provider organizations, the Service Employees International Union or SEIU, disability leaders, and advocates. The team met weekly for several years and now meets quarterly. We've completed several research reports, recommendations, and work plans passed by the Olmsted Subcabinet. One example is the Employee Recruitment and Retention Assessment and Guide for Service Providers. Another example is collecting data on the number of people entering nursing homes each month due to the lack of in-home paid or unpaid caregivers. We've developed and continue to work on a prioritized list of action items summarized in the next slide. The 7 priorities of the team are to increase worker wages and benefits, expand the worker pool, enhance training for direct care and support professionals, increase job satisfaction including job quality, raise public awareness by promoting direct care and support careers, promote service innovation, and enhance data collection. A number of members of the stakeholder group played a key role with the policy changes and legislation that passed this session, which Linda will talk about next.
Thank you, Oriane. So in this past legislative session, nearly all programs in disability and aging services received rate increases. Some of these included the PCA program received a 10.1% increase, likely the highest in Minnesota's history. Beginning October 1st, 2021, the SEIU union that represents consumer-directed workers bargaining agreement has PCAs in the consumer-directed service option receiving $14.40 per hour beginning October 1, and next October of 2022, this will increase to $15.25 per hour. Waiver programs are receiving a 9% increase in January, 6 months earlier than scheduled, and 80% of this increase must be directed to wages or benefits for direct care professionals. Parents of minor children and spouses are allowed to be paid as PCAs. Minnesota has an enhanced wage rate of 7.5% in the PCA program for people receiving 12 or more hours a day of services, which because of legislation will drop to those who receive 10 or more hours a day beginning in January of 2022. The SEIU agreement also included more money for paid time off and stipends for training for consumer-directed workers. PCAs in the future will be allowed to bill for time to drive the people they provide services to, and the PCA program will shift to a framework model so they don't have to keep requesting annual increases, and that rate system will function just like our current waiver programs do. Nearly all disability and elderly programs received some increases, and also American Rescue Plan money was allocated for more pay, workforce shortage grants, and grants for underserved and rural populations.
So in addition to the Olmsted Stakeholder Group and the legislative actions, in 2020, our Disability Services Division added the workforce shortage to our strategic plan. The plan has several goals, including to better communicate with the public about the work of the Olmsted Stakeholder Group, to identify activities that might mitigate the shortage, and to improve internal coordination on activities with other areas of DHS and with DEED. To complete this work, the division has created 4 subgroups, which are focusing on 1, compiling promising practices, 2, exploring new activities and projects, 3, communicating with the public, and 4, gathering data to support initiatives. So for example, our communication subgroup is coordinating with our policy areas to share with the public the new legislation that was just passed to help address the workforce shortage. We're also continuing to work on dozens of other projects. So for example, thanks to previous legislation, we are now collecting cost reporting and wage data from service providers so we can better track service reimbursement rates and consider policy changes. Another project we recently implemented is the Life Sharing Program, where people using services are matched with people in the community who are willing to provide supports and share their home and their lives. And we structured it in a way that's slightly different from traditional foster care, and we'd be happy to share that information with other states if you'd like to email us, but we don't have time in this video. Another workforce initiative is the Direct Support Connect website, where people searching for work can be paired with people needing support based on their shared interests and availability. Then within that website, we're planning to share more information about career ladders and stories about previous direct support professionals who are now working in other professions. And there are a lot of other initiatives, but the last one I'll mention today is working with providers and lead agencies, which include counties and tribal agencies, to promote the use of intervention services so that people who need more significant support with challenging behaviors, they're served by staff who are paid more and who have more training.
At DEED, we partner with the Olmsted Stakeholder Group to report and monitor data on direct care positions, which have been at or near the top of our occupations in demand list for many years and are projected to add more jobs over the next 10 years than any other occupation. We also support providers with virtual job fairs to recruit more workers. Additionally, we led a multi-agency study on healthcare benefit provision, which Minnesota is still exploring. We're also looking at apprenticeship opportunities with the Department of Labor.
All this work and more was made possible by hundreds of people who are helping to address the shortage, such as the previously mentioned Olmsted Stakeholder Group, state employees from many different departments, parents and users of services, providers, direct care professionals, advocates, counties and tribes, SEI Union, and many others across the state. We are very thankful for all of their hard work, and we look forward to our continued partnerships. Thank you.